When do I back up my lateral surgeries? It's very interesting that when you're doing lateral interbody fusions, the decision of using or not instrumentation posteriorly, basically to back it up, comes specifically first. You have to make sure if your patient has instability. We are talking about grade 1, grade 2 spondylolisthesis, when there is a significant movement, means like pars defect or any other factors. Definitely, I will always back up this type of problems. I will use bilateral pedicle screws because it's the most effective and biomechanically sound construct that we can put together. And then in other situation where I backed up is, for example, when the bone quality is not optimal. However, in my own practice, when the patient has bone density that is worst, -2 on the T-score on the femoral heads, my default is not to perform any kind of fusion or instrumentation. But when it's better than that number, and is in between, let's say, -1.5 and -0.1, there is a significant osteopenia. To protect during direct decompression, it is a very good idea to provide a posterior instrumentation, so back up those cases, because it protects your indirect decompression. Don't forget that when the cages go lateral, sitting on the end plates, if you don't have a solid bone structure, there is a risk of subsidence. And subsidence is basically the worst enemy of the lateral access surgeon in terms of protecting your indirect decompression. So just to resume, I like to back up my lateral cases in two situations. Patients with gross instability, where you have to provide some kind of good construct, and second, patients with bone density where it is not optimal with significant osteopenia. Everything is to protect the indirect decompression and avoid subsidence.